want to vote, but there is also a separate group who present with a less acute, a sort of a subacute change, and that's the group that I think we really want to tease out and talk about today. Most people, the presenting symptoms of a brain tumour depends on the type of tumour and whereabouts it is in the brain. And so the key thing is that people present with progressive symptoms over a period of 2 to 3 months. And those can be disparate symptoms relating to where the tumour is in the brain. So it could be increasing weakness of an arm or leg, but that could be fairly subtle. Tripping over a curb, not picking up your feet properly when climbing the stairs, a progressive tendency to drop things. More commonly with sort of lower limb weakness and sort of a frustration that somebody's stumbling when they're walking, but then that deteriorates or becomes associated with other symptoms. There can be personality change, where someone seems more irascible or disinhibited, speech disturbance, struggling to find their words, but also more subtle things like finding themselves unable to read subtitles or finding that they're getting muddled up when they're trying to compose an email or send a text. And visual symptoms, particularly peripheral loss. And it's not uncommon for us to meet people whose presenting complaint has been minor road traffic accidents. So they're driving and they either don't see a car coming at them from one side, or they're clipping wing mirrors, or similarly, if they're not driving, they're walking into door frames. And so the symptoms can be quite diverse and disparate, but the key thing is that these symptoms increase over a 2 to 3 month period, and different, sometimes very subtle symptoms can come into play. Rajiv's going to talk more about headache, but although people, sometimes do have headache, it's very, very uncommon for headache alone to be the only presenting symptom. And it is much more about being aware of the sort of more disparate, sometimes more subtle symptoms, which are all sort of then becoming more numerous and getting worse over quite a defined period of a number of weeks or a short number of months.
And I think missing brain tumours, it's one of the things we're concerned, one of many things we're concerned about. How important is it in terms of, in terms of prognosis, is it to pick these things up early?
So with brain tumours, so it's really, one of the many important things about brain tumours is that there are more than 130 different types of brain tumour. The gliomas are the commonest primary, so gliomas come in 4 grades. Grade 1 and 2 are low grade, grade 3 and 4 are malignant. Grade 4 is numerically the commonest primary brain tumour, that's a glioblastoma, and that's sort of brain cancer, that's the very aggressive one, and people will have had that for probably only a short period of time. But there are numerous other brain tumours like meningiomas, which may be benign or simply managed with surgery. In terms of prognosis and survival, there is not the same sort of linear relationship as there is with something like bowel cancer, where you pick bowel cancer or cervical cancer up early, and that definitely makes a massive impact on survival. Brain tumours don't have a staging system, so there's a less linear relationship. However, the importance of timely diagnosis in brain tumours is that if people have symptoms which are continuing before the brain tumour is diagnosed, they can be developing progressive and then irreversible neurological deficits, so that even once they have surgery or they have treatment, those deficits stay fixed. And so the importance of early diagnosis is about ensuring that we identify the tumour at a time when it gives the patient the best chance to